Depaul is well grounded in Chicago. This work is very impactful for the Chicago communities. I'm a professor in the School of Computing in the Jarvis College of Computing and Digital Media, as well as the Associate Provost for Research at Depaul. My research area is in artificial intelligence, machine learning, and computer vision with applications mainly to biomedical and healthcare informatics.
I came to Depaul in 2019. I had the opportunity to become a Sinai Urban Health Institute Fellow. So that means that I got to work with Sinai for a year on any of their projects. I worked on applying AI and machine learning to data from their community health workers. These community health workers do a lot of work. There's a lot of places where AI and machine learning could make this reporting easier. It could say how much time was spent with patients, how many resources were provided, and our goal is to show the value of their work.
Sinai Chicago has a very long history of serving the West and the South Side communities of Chicago, historically very marginalized, very under-resourced communities. We work a lot to address social determinants of health. Our patient population often has a lot of social needs that impact their health outcomes, and then linking patients to the appropriate resources.
So a community health worker is that bridge between the healthcare system and the community. We are advocates, we are liaisons.
Depaul University and Sinai Chicago are actually part of a larger collaboration trying to incorporate community health worker insights into developing a predictive model to best serve our patients and best kind of identify patients that need the resources that we have to give them.
One of the goals for the project is at the end of these 3 years of funding to have a dashboard that is used by the community health workers to have the view of in the morning when they come to work, what are the patients that need to be seen, and they will know based on the characteristics of the patients who is going to meet this type of patients.
Depaul data scientists have come on site, met our CHW team, and really have tried to listen to kind of our current workflows.
They had all the data that we had provided to them, and then they showed us how that data was categorized.
At the end of the day, we don't build tools that at the end we ask the users to use them. We make the users, in this case the community health workers, part of the process of designing, developing these tools. For the students, it's a unique experience in seeing what they learn in the classroom, how it's applied to real-world applications.
Over the past 8 months that I've been working here, I've been involved in analyzing patient records, looking at the text data that we have available in our patient records, communicating with the community health workers, trying to understand what they do, trying to understand their workflow, and trying to also integrate that into the systems that we build. It's a two-way street where I take in constant feedback from the community health workers and I provide them results, and at the same time, I try to make sure that the results are interpretable.
With the work that we do in the hospital setting and in the communities with patients, we end up collecting a lot of data, but oftentimes we don't have the resources or the time to do much more with that data. And so this partnership with Depaul is providing us with a lot more resources to take it that next step further for the benefit of the patients.
We are committed to improving the society in Chicago.
This is not only an investment in the university, it's an investment in the communities that we serve. As we are developing these tools and we create the dashboard, more we can scale up this project at the national level.
I've always wanted my work to somehow impact the people and make a big difference in the world. I'm really happy that I'm able to be a part of this research.